Okay, very pleasant introduction. Thank you. Yeah, my name is Shanker. I'm a surgeon, and I started out. Saya orang Malaysia, saya datang dari Malaysia. So I speak bahasa, tapi all the slides semua dalam bahasa Inggeris. If you have ada persoalan dalam bahasa, boleh minta tolong dalam bahasa, no problem. So it's just that I usually keep the talk in English because I don't want miscommunication or misunderstanding. So we can clarify later if there's any conflict. So today I have the privilege, and thank you to Penny and Father for very kind. Luke for talking to allow me to come here. This is a topic that is quite important. It's important for all of us. It's important to me personally because I have a young family. It's extra important to me because my wife Isabella is a dietitian and she supports me in the practice. So we actually take care of trying to treat this problem in a comprehensive way because there is no one solution. Masalah obesitas is a very modern problem. Not that obesity has not been around for many centuries, for thousands of years, but it used to be a problem of people who are very rich or the king or what, who have so much of food. But today, obesity is a problem of every socio-economic group. And in fact, it's more important in the lower socio-economic group because now the access to food is too much, and access to cheap, high-calorie food is far too much. And so it's becoming a serious problem. So I want to just touch on some of the issues related to obesity and why it's important to address it. And later, Dr. Penny will go through some of the tools of what we can do and lay out some sort of a plan of what can be done. Yeah? So actually, this was published in 2012 in the Daily Mail in the UK that obesity is killing 3 times more people than undernutrition, malnutrition, or lack of nutrition. Maknanya we have too much food, 3 times more people dying because of too much food than the other way around because of not enough food. This seems strange, especially for us, because in our lifetime when we were young, we were told, eat everything on your plate, eat everything. You know, people are starving in India, people are starving in all over the world, right? In Africa and all that. Look at the TV, you know, Ethiopia, these poor people all dying. But today we have gone, within one generation, in my lifetime, in the last 40 years, we have gone to the other side, where we have too much food. In fact, you should tell your children, please don't eat all of these things, because if you eat this, you are going to have a problem and you might be dying in the future. You know, sounds crazy, but that is the problem today. So we have actually so much of food and access to food, we don't even understand about what is this food and where it's coming from, what it's doing to us. Okay, so it's a real problem. It's recognized. This is published in Global Burden of Disease Study, published in Lancet. I just reported in the newspaper that this was a few years ago, that obesity is a bigger problem than undernutrition in the world today. Okay, it's real. Now, why is it real? Because as our weight increases, and a simple surrogate is actually the BMI. BMI is the body mass index. Is the weight in kilograms divided by the square of the height. Just now you measure your weight, and if you measure your height in meters, and you do your weight divided by the square of your height, you can compute the BMI. Now, as the BMI increases, many chronic diseases also increase together with this. Diabetes, heart disease, and stroke, more importantly. Okay, including cancer also. It's also increasing with BMI. In fact, together with this whole idea of obesity, it was realized, and this is only in 1988. I went to medical school in 1990. When I entered medical school, this was not in the textbook. This is the description of, at that time, called Syndrome X. Syndrome X. I don't know if you remember, Dr. Penny, if you were to learn about this. We didn't call, it wasn't yet called the metabolic syndrome. Now it's called the metabolic syndrome. What does it mean? It means obesity in the central compartment, which is ini lemak di dalam hati, di menyelaputi jantung, you know, so it's visceral fat, visceral obesity, not what is under our skin, not in the buttocks, you know. but it's inside. So people go for liposuction and all these things. This is just for body shaping. The real problem fat is inside. You can't suck it out. It's inside. So this central obesity is correlated with insulin resistance. Maknanya insulin ialah hormon yang dikeluarkan oleh pankreas kita ya. The insulin is released by the pancreas when we consume high energy food, sugar, fatty food, carbohydrates. Yeah? So the insulin helps us to store this high energy in our body as in the form of fat. Okay, it helps us to store. But this high energy food is like masukkan benzin dalam kereta ya. So if it's full, kalau tangki minyak sudah penuh, kalau kita masukkan benzin lagi, what happens is spill out, right? So the risk you catch a fire or something like that. That's exactly it. So if we have too much fat cell, lemak, sel lemak tu sudah penuh sampai sini, you try to put any more, it's not going to go. So that is when you have resistance to insulin, and that is a precursor of diabetes, type 2 diabetes. Diabetes ada two types. Type 2 diabetes is resistance to insulin. Type 1 diabetes ialah bila pankreas kita sudah hapus, tak boleh keluarkan insulin. That's type 1. That one no choice, you just need insulin injection. Tapi type 2 is because the insulin is depleted because of resistance and the pancreas is overproducing. Okay, 90-95% of diabetes in the world today is type 2 diabetes because of resistance, overproduction, and then eventually failure of the pancreas. And it's correlated with high blood pressure and cholesterol abnormalities as well. This is the metabolic syndrome. Okay. Now, but there are many problems related to obesity, and these are interlinked, and we understand them more and more. So under the physical problems, this is one of the important things that we don't realize. Sleep apnea. Sleep apnea itu ialah when you are sleeping at night, the weight here is too heavy, so when you are relaxed, just drop back and you can stop breathing. So you can hear, if you hear your partner, your husband, your wife snoring normally, that this is normal snoring. But sleep apnea happens when they go and stop breathing. Apnea means no breathing. Apnea is no breathing. Okay, so there is no breathing. That means someone having sleep apnea has a period when they actually stop breathing, then they start to wake up and they breathe again. If you hear this sound of your brother or your sister or your spouse, please bring them to see a specialist to do a sleep study. Okay, because they can get help. They need CPAP machine, or sometimes they need some clips to open the nose. Sometimes there's something you can put in the mouth to hold the tongue so it doesn't drop back. There are different things that can be used. But sleep apnea is serious because this chronic hypoxia is called. That means tak cukup oxygen masuk, because every time you stop breathing, you don't have enough oxygen. Then in the daytime, you feel very sleepy because at night you didn't have a good rest. So daytime when you're sleepy, accident can happen. Okay, I have two patients came to me because they were brought by their family because they fell asleep driving and crashed the car. Recently one lady came, she had to lose weight because the son said to her, "Mama, you don't drive me anymore." Because he was sitting next to her, 10 tahun anak dia. She was driving the car, she fell asleep, crashed the car in front. So he said, "Mommy, I see you're always falling asleep. Don't drive me anymore." So she came to lose weight because she knows she's very big size and that's the problem why she's, so it's very important that this is understood. Because of the hypoxia, not enough oxygen, this is what you can fall asleep, but long term it causes heart problem as well, because chronic hypoxia leads to chronic hypertension and various other things. Okay. Now, gallstone problem, 3 times increased risk of gallstone. The leg swelling and varicose vein and joint pains all happens because of wear and tear on the lower limbs of the body. But the most important is heart disease, diabetes, cholesterol problems, and hypertension. And also cancer. This is important. This is correlated to excess weight, whether it's leukemia, lymphoma, and especially for ladies. Many of the female cancers are related to excess body weight, like breast cancer, uterine cancer, and ovarian cancer as well. Okay? And menses problems. In Australia, the #1 reason for young ladies to seek weight loss treatment is because they have polycystic ovary syndrome or amenorrhea. They don't have regular menses, dysmenorrhea or amenorrhea. And this is related to excess body weight. So that's a big problem also for ladies. So the problem is when you are young, let's say you sudah sampai 50 tahun, 60 tahun and you are quite healthy and you are a little bit heavy. It's fine. You are already in your 60s and you are a little bit heavy, but you have no medical problems, no diabetes, no blood pressure, that's fine. I have no issues with that. But if you are young, you are 20-something or 30 years old and you have high blood pressure, you have borderline diabetes, these are the people that need attention. Because that's when you have a long time span, so more problems can happen and happen. Okay? So the benefit of taking control of the weight is not in asking your old uncle to go and lose weight, tapi to ask your young nephew, please, we need to control now. You know, it's a similar thing to smoking. Yeah? I always get a patient who come and tell me, please tell my papa stop smoking. He's 75 years old. He got some problem. I said, no, don't worry about him. Ask your brother to stop smoking. Because we have to keep a perspective. What is the risk factor and what is going to happen next? Yeah. So I'm not against if somebody is a bit heavy, but you have to look at the health impact. What is the health problem correlated to that? And young people are the ones that's most important to be focused on actually. Okay. In Singapore, this is data from Singapore National Health Study, 92, 98, 2004, 2010. The rate of obesity, itu maknanya BMI more than 30 naik, it's doubled already, so it's 11%. And correlated to this, as the weight goes up, BMI goes up, diabetes levels will go up. So in Singapore, exactly like that. Okay, so I'm not sure about Indonesia. Tapi Malaysia also had diabetes rate macam ini, 4%. Tapi Malaysia sekarang 16%. Okay, it's gone up 4 times. Singapore gone up 3 times. So it's gone up a lot. And this is gone up in all ethnic groups. Memang India, Melayu, China pun. Okay, all getting more and more diabetes. Very serious. And diabetes is one of the most serious. Actually, we consider diabetes is a cardiovascular risk equivalent. If you have diabetes, it's a very serious implication for stroke, eye complication, heart attack, kidney failure, leg circulation, gangrene. So diabetes is multi-system disease. Ini bukan just masalah gula, it's a blood circulation disorder for small and medium-sized vessels. Okay, so small vessels in the eye, retinopathy. I'm sure semua orang di sini, you have a friend or relative or you heard of somebody with diabetes who went for laser for the eyes, or who had a stroke, or who had a heart attack, or who had kidney failure, or who had gangrene, amputate the toes or amputate the leg. I'm sure, because this is so common. More than 10% of the population have diabetes. Yeah, so it is a serious illness. In time, many complications can develop. Yeah, so these are things that we want to address. So what are the cut-off points? Now, di orang Asia, the cut-off points for Asian is lower than the cut-off point for Caucasian. Why? Because kita orang Asia, for the same weight, we have more body fat. Okay? I don't know why. Ethnically, it's different. One of the theories is because as Caucasians move towards the colder climate and they have to have more body fat to survive in the cold, and therefore the body develop better. They somehow have less problem dealing with the extra body fat. Or maybe those who are sickly died out and they enter into new areas. This is thousands and thousands of years going back to the gene hypothesis. But basically for Asian, the cut-off points, once the BMI is more than 27.5, and for Caucasian is 30. Ini dianggap the level of obesity, 30, more than 30. This is when you need to start paying attention. It doesn't mean kalau BMI more than 30 directly it's a risk. Actually, in terms of our survival mortality risk, the cutoff is 35. Okay, it's here 35 because according to epidemiological study, maknanya when you do large-scale studies, people with BMI more than 35 have 2 times the risk of dying compared to people of BMI 25. Okay? Tapi from 25 to 35 is a bit of a borderline zone. Some people are okay, some people are not okay. Some people BMI of 29 already have diabetes and blood pressure, everything. Yeah? So it's different, it's a borderline, but it's not clear. But definitely when the BMI is more than 35, as a group, the mortality is double. Okay? So that's just something to keep in mind. Now, this one is probably more useful. This one you can measure now. Ada bawa tape measure. So you can, for this criteria for waist measurement, for WHO criteria for this is applied to Caucasian is 100 cm for men and 90 cm for women, or 102 and 88. But for Asia Pacific, for Asian, kita semua orang Asia ni, it's 90 cm for men and 80 cm for women. This is targeting central obesity, okay? The apple shape, not the pear shape, you know? Like, that's why the old folk story that when the man bring the girlfriend to the house, the grandmother always see whether the waist, the hips are big or not. Kalau big, this is the childbearing hips. Actually, it's because that is also healthy. If the waist is very plump, it's not healthy. Weight here is not healthy because this is reflective of body weight, fat inside the visual column. Okay? So that's why just using the waist cutoff itself can be a very simple marker for whether the person has got increased risk for obesity-related problems. Yeah? Now, this is for children. For children, we don't use BMI cutoff because BMI is not reliable until you're more than 18 years old. So before 18 years old, we just use the percentile charts. So in this sekolah, you have the percentile chart. Certain children at this percentile, that percentile, that percentile. In Singapore, they don't use the term obesity. This one is political. I don't know in Indonesia whether you have a category for obesity. Here they say you cannot say the child is obese. So we say the child is severely overweight, where the child is so tapi if more than 90%, then it's considered overweight, and 97 is considered severely overweight. So that's just a reflection for kids. Now, in Singapore kids, the presence is increasing, you know, the prevalence of these kids, because they draw the chart. Of course, this is a moving target now, because they draw the chart of percentages. Then the next year, the chart keeps moving up, right? So the fact that more than 10% means more and more kids are falling into this category for overweight. Okay. Now, this is the point about childhood obesity. Now, just before I go on, I'm a surgeon, so just in case you think that all this is a problem of Western countries and all that, I have had 3 young men in their 20s over 200 kilograms. Okay, so that's just over 200. 20% of the patients that I see are super obese, and they have BMI more than 50. Roughly the weight is more than 150. Okay, these are all Asian, our local people, Chinese, Malay and Indian. Okay, so it is not a problem of American eating McDonald's. No, it is us eating biryani and lontong and all our food, char kway teow and Hokkien mee and all that, So that's the thing. Now, this I think is a very, very nice chart to easily understand what happens to your happy young child if you don't pay attention. You have a young kid, healthy and happy, watch TV, play video games, eat some chips, and mama say go and study, slowly become malio. Just smile, little bit. Maybe wear spectacles. Then, a bit more, continue the same, play video game, watch TV, put on a bit more weight, feel not so sedap, cannot exercise, I don't like, I go out, I sweat a bit, get some rashes here, oh my god, stay at home, don't go in the sun. And it gets more, and then, oh no, now the children making fun of me, I can't catch them, I'm very breathless, sweating more and more. Then the mother complains because you come home, your clothes all sweaty, you have to wash your clothes all the time, how many time you change, right? So they put on more weight, and then they become embarrassed, they don't want to go out, and so this is a vicious cycle. I read somewhere, very simple. In the old days, when you come home from school, your parents say, go out and play, and come back later, 7 o'clock, makan. Go out first. Now, go to the room, play video game, play iPad, do homework. So we have to consciously say, stop the homework, close the book, go and play. Okay, enough. You do 2 hours homework in a day, I think it's enough already. Go and play. We have to make that step. You have to think about it, because, I don't know, it's otherwise they don't have a chance. Because this is the cycle, it keeps turning. You get heavier and you don't want to do anything. Because a child at this age can do anything. They can do anything. But once you are 10 years old and a little bit heavy, 15 years old, a little bit more heavy, it's already going downstream from there. Okay? So this is very important. This is from America, a poster which shows all the problems what's happening in America. Basically, the size of the food and drink, the amount of sugar consumed is going up and up and up. In the last 40 years, it's really going up. So why are people becoming more obese? It's obvious. This is the kind of food that we're eating. When I was a kid, when we went to the cinema, kita beli kacang putih, my brother and I shared one kacang putih roll up in one paper, kan? One, 2 of us share. Last time I went to the cinema, my daughter said, Papa, how many popcorn? You bought popcorn? I said, yes, I did. How many packets of popcorn? I said, one. Yeah, we share. I said, only one. Why didn't you buy for all of us? The popcorn is so big, it's bigger. The 2 of them head also can fit inside the popcorn. So much of, and it's not enough. No, it's not enough. How did we eat like that? We don't eat of kacang putih before, right? So the portion size is getting huge. Don't count the Coke or iced lemon tea. They're same, by the way. The sugar content is very high in all of these things. Okay? So it's important to think about that. Now, I have a few slides because one of my dietitian actually went to Cleveland Clinic in USA for a posting. So she passed me the slides to show you in a real setting, in a children adolescent clinic in the US, what kind of kids they are seeing. Okay? They are seeing kids, teenagers, 11, average age 11 years old, okay? And look at this is their results, okay? Anyone here who has ever seen blood result before health screening, you will understand. This is a 3-month sugar level, 6.2%. This is borderline diabetic. In fact, this is diabetic, but they are being treated. Fasting insulin level is 50 units. Fasting insulin level should be single digit, 3 or 4. Yeah? This is a teenage child with fasting insulin is high already. Triglycerides is the fat in the blood is high. The HDL, which is the good cholesterol, is low. Vitamin D is low, means very little sun exposure. And they do a sleep study. The child has OSA, sleep apnea. The child has fatty liver already. Okay, this is obese adolescent clinic in the US, and 75% of the kids have got one or more known medical problems associated with the obesity. Okay, so this is actually what's happening. So this child has severe obesity, cholesterol problems, is pre-diabetic, so they put on metformin, has metabolic syndrome, has sleep apnea, vitamin D deficiency, and fatty liver disease. In the United States today, the #1 cause of chronic liver disease, liver failure, and need for liver transplant is fatty liver disease. Di sini is still hepatitis. In some countries it's alcohol and hepatitis B, hepatitis C. Tapi in Western countries, it's now fatty liver disease. We see it now also. I have patients who have just got liver disease, they don't have hepatitis, they don't drink alcohol. It's just the food and the fruit juice that they drink. Okay? So these children have medication list like your parents, like our parents, you know. 70, 60, 70 years old people will have medication lists like this. 6, 7 drugs, right? This is a medication list for a child. So this is really what's happening in the US in some of these kids. So what is it we can do? It is a very simple poster design. It is one of the winners of the poster competition in the US to show how we can attack this. Simple things, yeah? Early things we can do, watch out for the chemicals that you're consuming, breastfeed the kids, you know, reduce the screen time. 2 years and under, 8 years and under, is it 1 to 2 hours a day maximum. Then get active, get the kids out, ask them to eat better food, real food, you know. So all the little things like this, these are the things that we need to do. Now I came across this is from Singapore, and this is by a nutritionist who actually looked at a child and intake, right, and worked out. Now the recommended intake is 1750 calories per day. I don't know if I don't think I showed you this. Did I show you this? No. So I picked it up. This is a recommendation. I think it's from HPV or somewhere. Look at what this child is eating. Weekday, 1 slice of bread with butter for breakfast. School recess, 1 bowl of fishbowl noodles. For dinner, 1 bowl of rice, 3 pieces of fried chicken, 1 sardine fish, soup, and snacks is cornflakes, apple, chili crackers, and 2 biscuits. This is ridiculous. I don't even know how they even talk about this as a normal diet, because my kids eat more than this. So I think there's a serious mismatch here. We have a problem, and then the advice given is like this. And on the weekend, instant noodles, lunch from a hawker store, 5 pieces sweet and sour pork, 2 pieces chicken, rice, and steamed egg. Clay pot fish head with rice. I don't know which child eats fish head with pork. So obviously this is not real, but this is ridiculous. You know, so I think sometimes we just have to stop and think for ourselves, you know, because look at this. Anybody's kids can eat like this, because my kids can't. They eat more than this. But I think the reality is you cannot also starve your child. And maybe some of these things we should change. You know, fishball instant noodles and dried instant noodles, that should not even be there. Because we were not allowed to eat instant noodles when we were children. You know, we eat something properly made. Sometimes we have instant noodles when I'm in the hospital because night time, midnight, snack, right? But yeah, so I think the family is critical. The family is the key. Because your children will eat what you eat. Your children will behave how you behave. So if it's okay for you, it will be okay for the kid. You know? So I always tell people, your chocolate, biscuit, cake, all these things, you have to limit. Your house, you have to limit. There's no point keeping it all in the cupboard and the fridge and, you know, hoping that your kid won't eat and hoping that you won't eat also. You know, because I know my wife there will be complaining if it's there, you know. So in the end, we don't keep it at home. But one day we say, oh, we feel like eating a cake. Okay, we either bake a cake or we get a cake. But then when we eat it, when the cake is finished, we just okay, you know. So I think it's important everyone has to eat together, because eating, especially for us, kita orang Asia, is social, it's cultural. You eat together. You know, it's very different from when I live in Europe. You are invited to wedding, huh? Come for the wedding of this and this day. Please indicate your dietary preference. So like, then you must choose. Do you want to eat fish, beef, or vegetarian? Then you pick. So you go for the wedding. Oh yes, sir. So it's okay. Please sit here, and then your serving comes. Very different. Western countries is very different. For us, all the food is there. So I think we have to really think about: do we need to eat everything? Because now it's crazy. I mean, I know this because I grew up in KL, and I went back to KL for my cousin's wedding. And look, when we were in KL, I mean, I ate reasonably. A lot of times we cook at home. In fact, many of my uncles, aunties' weddings we had in our house, where we invite people to come to our house and do the cooking, and we put the So cover the house, the road, outside, and then all all the makan is all there. So at home, and we don't waste anything, and whatever extra we bring to the kampung and distribute. That's how it was. But today I went to KL with my cousin's wedding. All the food is brown. Warna semua brown, like this curry, light color, creamy, or dark brown. Whether the vegetable pun tak nampak, no green, no red, it's all a bit brown. Light brown, dark brown. Even the rice is a bit brownish. I don't know what, add some things and all that, fried rice and various things. So the color and the taste and it's all seems to be the same. I was surprised. Here, one of my patients invited me to his wedding. I went to his wedding and I saw people who were piling on fish, chicken, mutton in the same plate. And it's, like a buffet. I can't remember that we eat like that, but I think we have to really put a stop to it, because if we are all doing like that, then we are going to be in trouble, because we will look like the fish, chicken, mutton at the same time. So much. Now, is there something we can do about it? What can we do? This is a very, very simple study. Okay, I won't complicate you with all the terms, but basically, one of the problems that we're dealing with today is fructose. Fructose, like high fructose corn syrup and all these things. Fructose is a form of sugar that naturally occurs in fruits and also in honey. But what's happened is that it's been concentrated from corn. So you have high fructose corn syrup and other ways they concentrate fructose, and it's sweeter. So it gives the sweetness and it's cheaper. So Coke and Pepsi, these companies, they started to introduce fructose to sweeten the drink rather than sucrose or other forms of sugar from the 70s and 80s, I think. So a lot of the obesity epidemic can be traced to this time as well, when all these refined chemicals enter the system. Now, the problem with fructose is that fructose can only be cleared by the liver, like alcohol. Can only be cleared by the liver. So that's why these chemicals stress the liver a lot. Okay? Now, basically this study is very simple. They took a bunch of kids, they just replaced the sugar in their diet with starch. Same carbohydrate, but instead of simple sugars, they changed to complex starch. And straight away, within 9 days, they noticed drop in blood pressure, drop in the cholesterol and fatty acids, glucose tolerance improved, and insulin levels dropped. So the insulin resistance fell within 9 days. Okay, so don't think that, wow, you're dead, man. I have all these problems, I'm so heavy, I can't. No, you can change it within 1 to 2 weeks. You will see the effects straight away when you start modifying and removing the simple sugars and the additives and all from the diet. So it's actually something that can be done, especially with children. The response is very fast. Yeah. So there's another study I read about Australian Aboriginals. This, in Aboriginal in Australia, their genes are supposed to be very, very primitive genes, so they cannot eat normal food, organic food, and all that. And so there was a group of teenagers where they were starting to get hypertension, diabetes, and all this. So they did a very simple study. They just took them from the city where they were, and they put them back into a rural setting, the same thing that the Aboriginal child would do in the rural setting. Took away all the city food, and immediately all the blood profile improved. So the food is very important. This morning I gave a talk and someone was asking me about exercise, how much exercise, brisk walk, how many minutes. But that is secondary. The food is primary. What we eat, what we put in our body is the poison. Not really, but yes, to some extent. Because what we put in our body, we need to control. How much exercise you do is important, but what we put in, it has to start from there. Okay? This is very, very important. So, in the end, why do we talk about this? Why do I talk about this as a doctor? Because this is an obvious target, because this leads to BP, blood pressure, cholesterol, sugars, sleep apnea, and that leads to all the disease. So I think question that you need to ask me as a doctor is, if I tell you, you go and torture yourself and cut out some of these favorite foods that you have, is it going to be of any benefit? The answer is yes. All the studies show that when you lose weight, you will live longer, reduce the risk of heart disease and cancer as well as dementia. Okay? So this is very important. So all these conditions will improve by changing your diet and lifestyle. Okay? That's not to say, because today there was one lady who was very upset. Doctor, I always eat at home. I never go out and eat. I'm very careful. 20 years I've been drinking kopi o kosong. Why I got blood pressure now? So I said, maybe you're a bit stressed. No, I'm not stressed, but I got blood pressure now. I've been doing so healthy all my life. No, the truth is, I don't know. I mean, life is complicated. You know, there's God, there's us, there's life, there's food. You know, as you get older, your body gets older and things change. But to me, if you reach 60 or 70 years, then you get blood pressure. It's a lot better than when you're 20 years old, you already got blood pressure and diabetes. You know? So I think certain things we can't walk away from it, because in life you will eventually end up with something. In the old days, people got TB and died, or got a severe infection and something happened. You know? But today we survive. So when we survive till we are 70, 80 years old, something has to happen. You know? It's like your car. You have your car, you keep driving by 20 years, you know, something will happen, something will give way. Okay? Now, so I think we should attack the way we eat and the way we live as the first step before you start taking this medicine, that medicine, and all these fancy things to treat. Yeah? And it's possible to get back normal, even though you have high blood pressure or diabetes. Because if you drop your weight 5 kilos, 10 kilos, how much weight you need to lose? About 5 to 10%. That means if you are 100 kilos, just lose 5, 7, 8 kilos, you will see a dramatic improvement in your health status, for sure. Okay? It's not a life sentence. When I was in medical school, we were taught that, oh, when you get diabetes, you start this medicine. Then after the next 2-3 years, you start the next medicine, then the next medicine, then the next medicine. That's not true. You can actually go the other way as well. You cut your weight down, you change the way you eat, you can cut back on your medication. Because food is medicine at the end of the day. And that's what we need to do. And finally, I mean, as a surgeon, we do have some percentage of people who really cannot get their weight down. I have some doctors who have come to see me, they have an operation. Now, just to tell you that, just like when you have cardiovascular disease, you do your diet, you do your lifestyle, you do your changes. But when the problem is very serious, there are interventions as well, like stenting and bypass. So this is what it's called. You know, so the same thing for obesity is serious enough, and that's why we have this kind of options that we do, and that's what I do. You know, just to put you in the concept. So basically, it's the new way. Obesity is serious. That's what I'm trying to tell you. Obesity is serious. In the majority of people, you can take care of yourself by changing the way you eat and drink and the way you live. But in a proportion of people, we can help you by controlling. So this, I put it up just for completeness, don't confuse yourself. There are various procedures. And this is where I just want you to be clear. This is normal. Normal BMI 18 to 25, orang putih, 18 to 23, orang Asia. This is overweight, 25 to 30. Okay? This is overweight. For Asian, 23, 27, 24. This is the categories. And BMI of 30 and above is considered obese. Now, normally, for me as a surgeon, when we talk about major treatment, we are only talking about someone from 35 and up. So you don't need to be here. You can be here. If you're healthy, you can be here. This dotted line is for people with diabetes. If you don't have diabetes and you're here or here, and you don't have any other medical problem, that's fine. So don't think. A lot of people come to me and say, oh, this is my ideal weight, 57 kilos. I'm now 95 kilos. I said, whoa, relax, you will look like some prisoner of war if you try to get down to 57 kilos. Right? So just be realistic. Let's go to somewhere here, which is usually a happy place for most people. So I think it's important to put things in perspective. Now, I think if you are here, chances are you need some help because you must be struggling with things. And I have patients who really have issues with so many of the things they do. That's different. But don't be so aggressive about taking your weight down. And I think everyone is different. So each person needs to have that sense to take care of themselves. Okay? So it's not about us, it's not about the doctor or the nurse or the dietitian, it's about you and your family and how you can best organize yourself. So this is one of my younger patients. She's 23 years old. This is the daughter of a physiotherapist in and she asked me, Doc, you think my daughter should go for operation? I said, your daughter at 23 has high blood pressure, borderline diabetes, because her husband is Indian, so she got Indian genes, Indians have all these metabolic problems. So she's already got that at 23. She was over 100 kilos and she couldn't get her weight down. Now she's 6 years out. She's maintaining her weight like that, 60 something. She just had a baby. Even after the baby, she's managed to keep her weight down again. So I think that's the important thing, trying to focus on what you can do for yourself. And when you're young, the benefit is the best. And finally, I think just to put into perspective, some of these patients, this lady was on insulin, taking a lot of insulin, and a regular doctor was not there that day in the clinic, so she was seen by Dr. Sunari. Dr. Sunari told her, hey, why don't you go and see this doctor to talk about what are your options. So, dia punya adik had a lap band and totally useless because he said, in fact his lap band was put by my boss before and he's always complain, bila makan, tight, I vomit and all that. So my boss asked him to come and see me to take out the lap band. So it was totally wasted for him. He was a big size guy, he lost maybe 5-7 kilos, he gained back the weight, in the end he just removed the band. So she said to me, why should I do anything? I said, look, it's not for me, it's for you. And she said, my brother did it. I said, yeah, you see your brother, you understand. So she made all these changes. The way she eats, how active she is. She runs a shop next to Mustafa. They have a family business, emporium. Now she handed over to the children who are already running it. So she, after she went for gastric bypass, she's totally off the insulin. And she decided to be healthy because she wants to take care of all the grandchildren. So she can run around with the grandchildren and all those things. So I think people need to make the choice for themselves. So finally, that's the end of my talk. And I think Dr. Penny has a very important part after this to talk about what are the things that all of you can do as a group and something that to focus on. But if there's any questions, we can take it now or at the end. Later. Okay, no problem. Alright, thank you very much.